The Committee on Oversight and Government Reform will come to order. This hearing on 1 in 88 children, a look into the Federal response to rising rates, will come to order. The Oversight Committee exists to secure two fundamental principles. First, Americans have a right to know that the money Washington takes from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn obligation is to hold government accountable to taxpayers, because taxpayers have a right to know what they get from their government. We will work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. This is our mission, and I might say today, in many cases, we are dealing with people who, because of this affliction, may never pay taxes, but in fact, their families and others pay for an entire life. Congress spends a lot of time discussing and debating issues and determining by our philosophical beliefs what the role of government should be. As we have seen in these debates surrounding TARP, stimulus, health care reform, these kinds of issues oftentimes come down to where you fall on an ideological spectrum. Today is no such thing. We are having a hearing focused on something that spans the ideological left to the ideological right. We are drawing attention to something that has no political affiliation, no partisan allegiance, and sometimes, and we believe today, not nearly enough focus on something that does not shorten life, but dramatically or even slightly, but usually more than slightly, reduces the quality of life, both for the individual and for their families. I am a father. As far as I know, I am one of the fortunate ones. I am not the 1 in 88. But right now, if the numbers are accurate, and if they continue to grow from the now 1 in 88 that in some way are ASD affected, we in fact have an epidemic. It could be that some of the 1 in 150 of a century at the start of the previous century was too low, that in fact people were simply not diagnosed. But few people believe that in fact there aren't factors in our society and our behavior, in the air we breathe, the water we consume, or others, that are affecting how many people will be afflicted. We are going to hear from a distinguished panel first of people who do this for a living, try to get to the causes, prevention, I won't say cure today, but at least the treatment, the understanding, and perhaps in some cases truly something that would mitigate their suffering. I know they are frustrated. Congress, although we put nearly $250 million a year directly into research, has not put the kind of dollars, perhaps, that could bring specific outcomes sooner. On our second panel, a number of individuals will say that, in fact, one of the problems is we are looking on one side of the equation and not nearly enough on what to do for the victims of various parts of autism. The fact is they are all right. There is not enough money being placed on the various possible causes of autism. There is not enough study. Our government does not collect statistics as well as perhaps someday soon we will, so that in fact we can find out what the true number is, cross-check every aspect of how that number, which is a human being, came to be afflicted. The truth is we have a lot to do. I will not claim that I have come here timely. This is the last few days of my first 2 years as chairman, and this is our first hearing. What I will promise you here today is that we will stay involved in this issue. We will stay involved through staff and through, if appropriate, additional hearings. I also would say to our first distinguished panel that one of the most important priorities I place today is, in fact, that we work with you and help you in this process, that we be a conduit to the rest of Congress on this important issue. In a few moments, I will be swearing in I'll be recognizing by unanimous consent a number of members who would not ordinarily be here at a hearing because they are involved in this issue but serve on other committees. Additionally, I want to apologize to all of those people who rightfully so would be well to be heard here today. I could have had a second panel of at least 20 witnesses from organizations and from affected individuals. We had the difficult job of selecting just 6. And as the ranking member will undoubtedly agree, 6 is already a fairly large single panel. That's one of the reasons I pledge to you today that any organization or individual that in the next 7 days provides to us, as required by our rules, in electronic format, or if you give it to us in paper, we will try to scan it. We will include your statements and your information in the record. We'll hold the record open so that the many who could not be heard live in testimony will, in fact, be at least in the record. I want to particularly recognize Brian Hooker with Focus Autism, the American Academy of Children, and actually it's a long title. Who in fact has been one of the people who has championed for today's hearing, and a number of others. They've been essential in my getting a better understanding. I also would like to thank, and we will be recognizing 2 witnesses or 2 members on each side, the former chairman of the full committee, Dan Burton, who years ago began a process of focusing on some aspects of this terrible disease. We, in fact, don't know enough. Our goal is to know more. Today is but a down payment on that. And with that, I'd like to thank the ranking member for his assistance in putting together today's hearing and recognize him for his opening statement.
Thank you very much, Mr. Chairman, and I do thank you for holding today's hearing. Before I get started, I want to pay special note, as you have already done, to our friend who is leaving, Mr. Burton. Over my 17 years on this committee, this has been an issue that he has constantly put forth and constantly made sure that we tried to address as best we could. And so, Mr. Burton, I want to thank you for your vigilance, and I want you to know that although you may be leaving the Congress, as the Chairman has said, we will continue the fight, and I know you will too. Mr. Chairman, we have learned much about autism spectrum disorders over the past decade. Taxpayer-sponsored research has identified risk factors and evaluated therapies to assist with some symptoms. Physicians and parents now have a better understanding of the developmental signs and the symptoms, allowing for earlier detection. And educators have experience with new methods and approaches for assisting children with autism. Congress has also acted to help individuals with autism and their families in significant ways. In 2010, we passed the Affordable Care Act, which contains significant new protections. Insurers may no longer discriminate against individuals based on pre-existing conditions. Insurers may no longer impose lifetime caps on health care coverage. New plans must include screening for autism without additional costs to the parents. And young people diagnosed with autism spectrum disorders may remain on their parents' health insurance plans until they are 26 years old. These are real and significant protections that will improve the lives of millions of American families. Even with this progress, there is still more to learn, and there is still more to do. While autism affects all racial, socioeconomic, and ethnic groups, some studies have shown that African American, Hispanic, and Asian children are less likely to receive an early diagnosis. These delayed diagnoses cause minority children to be further behind in the development of language and motor skills. We must be vigilant in emphasizing early detection and intervention for all our children, as an early diagnosis can make a critical difference in the lifelong development of a child. We must also continue to invest federal research dollars in new and evolving therapies to improve the lives of those with autism spectrum disorders. In my district, we house the Kennedy Krieger Institute, an internationally recognized institution dedicated to improving the lives of individuals with developmental disorders. These institutions improve the quality of life, education, and continued development of those affected by autism spectrum disorders, and we must continue to support them. Today's hearing is an opportunity to examine what has been done about autism spectrum disorders to date and what more needs to be done in the future. There are many experts, individuals, and groups who can help us in this effort. And I want to take this moment to thank all of you for being here. As the Chairman said, there's so many people who are interested in this issue, so many who wanted to speak. But I want to say to you what I said to Bob Wright of Autism Speaks a little earlier today. I thank you for caring about somebody other than your children and yourselves, because what you are doing here today is raising this issue so that other children, other than those, or other folks, other than those who may be in your own families, maybe your friends, will benefit in the future. In other words, you are touching the future, and you are making it possible for those who are going through the autism spectrum disorders to have a better future. And so I thank you all for what you're doing. And as I said to Bob Wright, you must stay the course. One of the things that I've learned from being in Congress these 17 years is that in order for these causes to move forward, you have to keep banging the drum. And you must keep banging it louder and louder and presenting your case so that after it's all over, there's not, as my mother would say, motion, commotion, emotion, and no results. I want you to be successful in what you're doing. Life is short. And so what we must do is try to use our energy so that we can get the best possible results. And I am so glad the Chairman said what he said about sticking with this, addressing it, and we encourage all of you to work with us as we move forward. And with that, Mr. Chairman, I thank you.
I thank the gentleman. We now recognize the former Chairman of the full committee, Mr. Burton, for 5 minutes.
Thank you, Mr. Chairman. Let me start off by saying that contrary to what has been stated in the media over the years, I am not against vaccinations. I believe that vaccinations have a very important place in our society and have given us one of the best health regimens in the history of mankind. People live longer and live better and have less disease because we have vaccinations. What we have always opposed is putting toxic chemicals or metals in the vaccinations. Thimerosal contains mercury. When I was a boy, we used to have mercury in thermometers. And they said if you break that thermometer and the mercury gets on your hands as years went by, that was toxic. In Indianapolis, we had a school where in the chemical laboratory or in the health science room, they broke a vial that had some thimerosal in it. They evacuated the school. They burned the clothes of kids that came in contact with it, and the fire department came in with all kinds of equipment to make sure they weren't exposed to it. Women who are pregnant, they say don't eat fish that has mercury in it, and they caution them that there's certain kinds of fish you don't eat. You don't drink water that has any mercury in it. There's all kinds of reasons not to be exposed to mercury, and yet we continue to put it in vaccinations as a preservative. In 1929, they came up with thimerosal. They tested it on 29 people that had meningitis. They all died of meningitis, but they said the mercury in the vaccinations or the thimerosal didn't cause any of the problem. It was not a contributing factor. So ever since 1929, it has never been completely tested, and they continue to use it in vaccinations. It wasn't so bad when a child got one vaccination or two or three, but when they get as many as 28 or 29 before they go in the first grade, it really hurts them. It causes a cumulative effect. The brain tissues do not chelate it. It stays in there, and it causes severe, severe problems. Now, I had, during the chairmanship, which I had in this committee when I was chair, for 6 years, we had about 4 years of hearings. We had people from all over the world, scientists from every part of the world, doctors from every part of the United States who testified. And people from CDC and FDA said there's no evidence that the thimerosal causes any neurological problems in people who are vaccinated. And then we kept on, and finally we had some people from FDA and CDC who came and testified and said there is no, get this word, there is no conclusive evidence that the mercury in the vaccinations causes neurological disorders. No conclusive evidence. Now, that word conclusive ought to stick in everybody's minds, because what it means is there's a possibility. And my question has always been, and I'm convinced that the mercury in vaccinations is a contributing factor to neurological diseases such as autism and Alzheimer's. I'm convinced of it after all those years we had hearings. But that word conclusive, there's no conclusive evidence, creates a doubt. And my question to the presidents and CEOs of pharmaceutical companies has always been, if there's any doubt that the mercury in vaccinations can cause a neurological problem, then get it out. You shouldn't put mercury in any form in the human body, especially in children in vaccinations, or adults in my opinion. When we get a vaccination for flu, every year we get a flu vaccination, we have thimerosal, fellas. I don't know if you know that or not. They're injecting a certain amount of mercury in their bodies. And over a period of time, I believe it does have an adverse impact on the neurological system of adults. I think it's a contributing factor to other diseases such as Alzheimer's. But let me just say that the thing we need to do is always err on the side of safety. If the pharmaceutical industry were to go to single-shot vials, then you would eliminate the possibility of neurological problems from vaccinations because there wouldn't be any mercury in it. And the last thing I want to say real quickly, I've got 27 seconds, is we passed the Vaccine Injury Compensation Fund to compensate those people who were injured by vaccinations. And it was supposed to be something that was people could work with the government to get that money. The pharmaceutical companies were putting money into that fund. But it's so hard for a person who's had a damaged child or a damaged adult to get any money out of that fund. It's unbelievable. And we need to reevaluate that fund to make sure people who are damaged by mercury and vaccinations need to have access to that so they can at least have some compensation to help with the rest of their lives. These people are going to live 60, 70 years, and they're going to be a burden not only on the families, but on society itself.
I thank the gentleman. The gentleman yields back. I now ask unanimous consent that our colleagues, Mr. Posey of Florida, Mr. Barrow of Georgia, and Mr. Matheson of Utah be allowed to sit on the dais and ask questions at the conclusion of other seated members. Without objection, so ordered. It's now my pleasure to recognize the distinguished gentleman from Illinois, Mr. Davis, for 5 minutes.
Thank you, Mr. Chairman, and I thank you for calling this hearing. As one who has spent much of my adult life working as a professional in the areas of health planning, health research, and delivery, I firmly believe that the Federal Government has an important role to help understand autism spectrum disorders and to address the needs of our citizens with autism across their lifespans. I, too, want to commend the former chairman of this committee, my good friend Dan Burton, for using his position as chairman and beyond to focus on this particular issue and cause the committee and others to continuously take a hard look at it. Dan, I commend you for your efforts and certainly wish you well as you revert back to private life. I'm very proud to represent a premier institution involved in the research and service provision of people with autism, specifically the Therapeutic School and Center for Autism Research, operated by the Easter Seals in my congressional district as a part of the Illinois Medical District, which is the largest medical district in the country. This one-of-a-kind facility is unique in the nation because it combines on a single campus educational, research, training, early intervention, school-to-work transition, and independent living capabilities. The continuum of services for persons with autism is impressive and will help advance a research-driven context for teaching, learning, and clinical and medical interventions related to autism. As an ardent advocate of persons with all types of disabilities, physical, mental, or developmental, I strongly supported the provisions of the Patient Protection and Affordable Care Act that protect families and individuals affected by autism spectrum disorders. I want to thank all of the witnesses for coming to join with us. Again, Mr. Chairman, I thank you for calling this hearing and look forward to our discussion here this afternoon, and I yield back the balance.
And if the gentleman would yield his remaining time to the gentleman from Ohio, I'd appreciate it.
I would be delighted to do so.
Mr. Kucinich is recognized for 2 minutes.
Thank you very much, Mr. Chairman. Having had the opportunity to work with Mr. Burton on this for the last 10 years, I remember well, as I'm sure Mr. Burton does and some members of this committee do, a time when a provision was snuck into a bill on Homeland Security that essentially shielded from lawsuits the manufacturers of thimerosal. This was 10 years ago. And you know what? No one, for the members that have been here less than 10 years, no one knew where that provision came from. It came out of nowhere and ended up getting buried in a conference report, and of course it passed. And, you know, I mention this because it's not as though we just discovered this matter, and while I salute the Chair for holding this hearing, we didn't just discover this. And my own theory is, well, there's studies that are out there that are implicating environmental factors in autism. Think about this for a minute. We know, as Mr. Burton laid out, the component of thimerosal, one of the components supposedly to stabilize it, is mercury. Well, we all know that mercury is more than a contaminant. It's an environmental toxin. But it doesn't only exist in liquid form. It's, you know, mercury can also be inhaled. And I would guess, and this is just my theory, that we're not only talking about drug manufacturers, we might be talking about coal companies too. You know, we have to be aware. There are reasons why this Congress and this government has not effectively addressed this issue. And when you had Lilly and others, Eli Lilly and others, contributing millions of dollars to try to affect the outcome of elections, you know, I will tell you, well, I salute this Chair for taking this on, because at the bottom of this, you have special interest groups who would resist any deeper research on it because it's going to affect their bottom line. Meanwhile, you have children all over the country turning up with autism. So this is a new beginning. I salute the Chair for making it, but this goes way beyond thimerosal, and you could start thinking about coal. Thank you.
I thank the gentleman on all sides. I now ask unanimous consent that our colleague from New Jersey, Mr. Smith, be allowed to participate in today's hearing. Without objection, so ordered, and I will announce that if any individuals would like to be in a little more comfortable situation, we do have an overflow room, and if they would just let our staff know, they'd make sure that if they gave up their seat here, that they would be able to be in the overflow room. It may be more comfortable for some of our guests. I now turn to our first panel. Distinguished Dr. Alan Guttmacher is Director of the Eunice Shriver National Institute of Child Health and Human Development at the National Institutes of Health, and I actually knew the namesake of your organization during her time. And Dr. Colleen Boyle is Director of the National Center of Birth Defects and Developmental Disabilities at the CDC. And with that, pursuant to the requirements and rules of this committee, would you please rise to take the oath and raise your right hands. Do you both solemnly swear or affirm that the testimony you are about to give will be the truth, the whole truth, and nothing but the truth? Thanks. Please be seated and let the record indicate both witnesses answered in the affirmative. You are important witnesses, and we will not stop you if you go slightly over 5 minutes. But we do have a large second panel, and I would ask that you bear in mind that all of your opening statements and additional extraneous material you may choose to submit to us will be placed in the record. So if you abbreviate or go off message, it doesn't change the official record for you. And with that, Dr. Guttmacher, you're recognized.
Thank you, Mr. Chairman. I'm also a pediatrician and medical geneticist and a member of the Interagency Autism Coordinating Committee, or IACC, reauthorized most recently by the Combating Autism Reauthorization Act of 2011. Let me thank the Congress for its continued support of research and other activities regarding autism spectrum disorders. That support has made possible remarkable advances in autism research and helped to better identify and meet the needs of people with ASD and their families. ASD includes diverse conditions that share distinctive styles of or impairments in communication skills and social interactions, as well as restricted, repetitive, or stereotyped behaviors. The combination and degree of impairments vary, creating an array of conditions that range from what many would see as normal to significantly disabling. 2 decades ago, ASD was thought rare. Today, with CDC's latest prevalence estimates, it is a national health priority. The IACC plays a pivotal role in bringing together Federal agencies, nonprofit organizations, and the public to identify priorities and strategies to address them. It includes individuals on the autism spectrum, parents of children and adults with ASD, other advocates, researchers and service providers, and officials from Federal agencies. The IACC welcomes public comment at all full committee meetings, regularly invites written public comment, and holds town halls. Thus, a diversity of perspectives on ASD informs IACC activities and recommendations. It is a committed group. While the law requires 2 meetings a year, the committee and its subcommittees meet as many as 17 times a year. The law charges the IACC to update a strategic plan annually. We are drafting, as always, with autism community input, a 2012 update that reflects the latest advances, remaining gaps, and emerging needs in autism research. The plan encompasses priorities from fundamental biology to services across the lifespan. Over the past decade, autism research funding has grown substantially. The NIH leads Federal research efforts on ASD, investing $169 million in fiscal year 2011, 3 times more than 10 years ago. In 2009 and 2010, $122 million in additional American Recovery and Reinvestment Act funds were also invested. As Congress has emphasized, early diagnosis and intervention are critical. This year, NIH-funded researchers identified brain pattern aberrations at as early as 6 months of age in infants who went on to develop autism, the earliest such changes ever recorded in autism, and one of a number of recent findings to suggest that the factors causing autism may operate very early in development. Last year, researchers demonstrated that doctors' offices can use a short questionnaire to screen inexpensively for ASD at the 1-year well-child visit. Another promising diagnostic tool, a 1-minute test that detects eye gaze patterns specific to autism, had nearly 100% specificity in infants as young as 14 months. But early diagnosis is valuable only if effective interventions are available. Recent ASD trials have validated early interventions to improve health outcomes and quality of life. For instance, a recent behavioral intervention study showed improved IQ, language, and social development in young children. And progress is also being made on interventions for adults. A recent study showed, for instance, that for the many adults with ASD who have impaired ability to recognize faces, a computerized training program improved facial recognition skills. Many recent advances have come from NIH's Autism Centers of Excellence program, which currently supports 9 centers and networks across the country, with 2 additional awards expected in 2013. The research covers a variety of topics aligned with the IACC strategic plan, including nonverbal ASD, genetic and environmental risk factors, potential treatments, and determining why ASD is 5 times more common among boys. We do not know the causes of ASD, but recent findings highlight the need to focus on both environment and genetics. NIH and CDC have established large research networks to collect extensive data on environmental exposures and health outcomes and conduct powerful analyses to identify factors that contribute to autism. Those networks explore possible causative factors in the environment before, during, and after pregnancy. Just this week, one of these networks published a study that suggests prenatal and early life exposure to car emissions is associated with autism. On the services front, HRSA has invested substantially in improving physical and behavioral health of people with ASD, practitioner training, and service provision. In fiscal year 2012, Congress appropriated over $47 million to HRSA for autism and other developmental disorders. This supports 43 interdisciplinary training programs, which provide services and training to 41 states and include autism intervention projects for underserved populations. Federal agencies also use public-private partnerships to maximize our work, such as NIH's National Database for Autism Research, which coordinates with other autism data repositories to enhance researchers' access to data. Programs like these that involve collaboration with patients and families bring together hundreds of researchers and clinicians with tens of thousands of people nationwide affected by ASD. The Administration on Intellectual and Developmental Disabilities, with help from several nonprofit organizations, supports the Autism Now project, offering a call center, a web-based clearinghouse of resources, and twice-weekly autism webinars. The NIH-supported Association of University Centers on Disabilities is improving early identification of autism through 25 Act Early ambassadors who train physicians in identifying, diagnosing, and managing ASD. In conclusion, since the establishment of the IACC, a wide variety of research, service, and education expertise have come to bear on autism. Research is rapidly translating to practical tools for use in the clinic and the community. Federal agencies are coordinating efforts to identify best practices to support the lifelong education, health, and employment needs of people on the spectrum. Thank you for this opportunity to provide testimony on such an important topic.
Thank you, Dr. Boyle.
Good afternoon, Chairman Issa, Ranking Member Cummings, and distinguished members of the committee. Thank you for the opportunity to be here today. I'm Dr. Colleen Boyle. I'm an epidemiologist and the Director of the National Center on Birth Defects and Developmental Disabilities at the Centers for Disease Control and Prevention. CDC works to keep America safe from health threats of all kinds. Our FY 2012 autism budget is about $21 million, and today I'm going to describe how we use those funds. Autism spectrum disorder, or ASD, is an important public health concern in the United States. ASD is a group of developmental disorders characterized by unusual patterns in communication, behavior, and attention. While there is no known cure, research is yielding innovative screening tools to detect ASD in early childhood and new behavioral therapies that can improve outcomes. CDC data indicate that more children are being identified with an ASD than previous years. The toll of ASD is significant and has profound implications for affected children and their families. CDC works steadfastly to alleviate this burden by tracking ASD, promoting the early identification, and addressing the unanswered questions through research. CDC supports ASD surveillance or tracking in 12 states: Utah, Colorado, Arizona, Missouri, Wisconsin, North Carolina, New Jersey, Maryland, South Carolina, Arkansas, Alabama, and Georgia through our Autism and Developmental Disabilities, or ADAM network. ADAM's goal is to provide comparable population-based prevalence estimates in different sites over time. In March of this year, CDC released updated estimates of the prevalence from the ADAM network based on our 2008 data, indicating that 1 in 88 children had been identified with an ASD. This is greater than the prevalence of 1 in 110 released in 2009 based on 2006 data, and 1 in 150 released in 2007 based on 2002 data. While there is no simple explanation for the increase, we know that it is due, at least in part, to improved diagnosis and increased recognition. Data from the ATOM network provide more than just a prevalence estimate. And because of this data, we know that ASD remains nearly 5 times more common among boys than girls. We know that the largest increase over time are among Hispanic and African American children and children without intellectual disability. We know that the prevalence varies widely. The identified prevalence varies widely from 1 in 210 to 1 in 147. And that although more children are being diagnosed at earlier ages, there are far too many that are not diagnosed until it's too late to receive the full benefit of early services. Overall, it's clear that families and children need help, and our data is helping to provide that. Research tells us that the earlier a child is connected to services, the greater the benefit. CDC works to increase early identification by offering free tools and assistance to states through our Learn the Signs Act Early program. We provide these tools to healthcare professionals, child care providers, and parents with a focus on minority and economically disadvantaged populations. CDC is also working with our federal partners to provide national goals in early screening, diagnosis, and service enrollment, giving communities as well as the federal government a benchmark to measure progress. To identify causes of ASD, we must first understand the risk factors. CDC's study to explore early development is the largest epidemiologic study of ASD in the country, and it involves sites in Georgia, North Carolina, Massachusetts, Iowa, California, and Pennsylvania. CDC works to identify factors that put children at risk, including genetic, environmental, maternal health, and behavioral factors, with a special emphasis on the interaction between environment and genetic factors. We are an active member in the Autism Coordinating Committee, and we really provide that epidemiologic and public health perspective. CDC contributed to the development of the IACC Strategic Plan for Autism Research, and our activities are key components of that plan. ASD is an important and an immediate public health concern. More children than ever are being identified, and families and communities are struggling with the financial burdens, the complex health care decisions, and the service needs. We know it is frustrating to have more questions than answers, and we share that frustration and are committed to improving our understanding of what is putting our children at risk. CDC will continue to document the burden of ASD in states through our ATOM network, develop resources, and help states improve early identification through our Learn the Signs Act Early program, and maintain our important epidemiologic focus through the SEED Research Network to understand why some children are more likely to develop autism. Thank you for the opportunity to present this testimony, and I'd be happy to answer questions.
Thank you both. I'm going to recognize myself first, and I'll ask both the experts to forgive me for being very basic in a couple of questions, but I hope that it sheds a balance on this hearing. Dr. Boyle, as far as you know, for either of you, does autism in history predate all vaccines? In other words, was there autism before there were vaccines?
I would turn to my colleague, my physician colleague, but I would say definitely. Yeah.
Doctor?
So autism was the first not described until 1943 by a constituent, actually, of Mr. Cummings, Leo Conner, who was a child psychiatrist at Johns Hopkins, who first noticed 11 individuals with similar patterns of behaviors that he described and coined the term autism to describe.
But were those likely or documentably things we can look back into history? And I want you to say with certainty or with likelihood, because I think it's important for all the people who are dealing with this affliction.
Absolutely. I know that Dr. Connor's view, and I think others, is that this probably existed before, just no one had noticed the pattern. There's certainly descriptions of individuals from well before the immunization era who would have what we would take today to be autism spectrum type disorder. It's not well documented before that. I think there's heavy suspicion that it existed before vaccination.
Okay, now I'm going to follow up with that. Is it fair to say that today the state of science, and I think Dr. Boyle said this very well, is that autism of various types has multiple causes in each of your opinions?
Absolutely, and they have both a genetic, biological basis and also an environmental basis.
So, again, I'm trying to be very basic, and I apologize, but I think for all of us as we go through this, it's important to sort of build on something. So it's fair to say that autism, like cancer or like other diseases often, is a group of afflictions, meaning that although the characteristics may be similar, in fact, there are multiple causes and thus likely multiple treatments and or multiple forms of prevention.
I think it's not only fair to say, but I think as simple as that question may be, it's the most important question in some ways to ask, because it explains some of the challenge in trying to figure out autism, but also points the direction to do it. Until we can better understand the biological bases of these different forms of autism, it will make it difficult to understand any of them.
I want to ask each of you one of the toughest questions, and I inherit this series of hearings, but I want to inherit them new. Is it fair to say that we can rule nothing out in absolute terms from being a contributor? You heard the gentleman from Ohio talk in terms of mercury coming in air form. Obviously, the former chairman spoke of the possibility of vaccines having a direct relationship. Is it fair to say that these multiple causes that we suspect, the fact is we can rule nothing out, including, and I'm not stating as a fact, I really am stating as a question, including things we haven't yet looked at? Is that possible, that there's yet more causes that will be viewed and nothing can be ruled out?
It's certainly true that those things we haven't looked at yet we can't rule out for sure. I think that there have been some things looked at very heavily that, while it's always difficult in science to rule anything out as a possibility for occasional individuals, I think there's sort of gradations of suspicion, and there's some various kinds of possible factors been looked at so carefully that we can rule them out as being involved in the vast majority of individuals.
I'm going to ask one last question, and then I'm really feeling like this is so far above my head that as I continue to study and work with people, I'll learn more. But one of them that wasn't mentioned in either of your opening statements, but I believe is now under suspicion, is the age of parenting. Would either of you feel comfortable talking in terms of we as a society are waiting till later, both on the male and female side, to have children, and science is cooperating with us? Do you believe that that is an area that needs further study?
It does need further study. There is certainly some evidence to suggest that paternal age particularly does have some correlation with the rate of autism. It's clear, though, that that's not a factor. I can learn many older fathers have children who do not have any form of autism. Many younger fathers have children who do have, quite frank, autism. So it's in any given situation, it's not the factor, but does, in a public health sense, does it play a role? It does.
Thank you. And I apologize I didn't have time to ask any questions related to what to do with people once they are afflicted. And quite frankly, I don't think I've done enough justice to the fact that there are so many interest groups, each of which is fragmented into components that I didn't even mention here today. But I thank the ranking member and would recognize him here for his questions.
Thank you very much, Mr. Chairman. Just kind of following up on what the Chairman just asked. You know, in talking to folks behind you, there seems to be a frustration. I see everybody's, I wish you could see them behind you. They're shaking their heads. There's frustration.
People know, yes, it's time.
With regard to coordination of efforts, with regard to, research, and I guess what what I hinted in my opening statement that I want us to try to move towards trying to make a difference. And I know that's why the chairman feels too. You know, we don't know how long we're going to be sitting on these panels and in the Congress, but we want to use our time effectively and efficiently. And what can we do to help the folks behind you get to the coordination, the kind of things that they're looking for to have an impact? Because they are thoroughly frustrated. So, I mean, can you help me with that? Can you help us?
Yeah, I think we can also share your frustration. I think all of us are frustrated at the rate of progress in terms of really understanding autism, having interventions to make a difference. So we clearly share that frustration. Perhaps because we're involved in it, we have obviously a different perspective on the frustration, but we not only understand that others have it, but do share it. I think in terms of what the Congress can do, I think some of you have already done, clearly in terms of funding for this area, but also I think in terms of the role of the Interagency Autism Coordinating Committee, and specifically the area you've mentioned is the frustration, that is coordination. I think the IACC has done a very good job in its relatively few years of existence, in fact, in coordinating both work among Federal agencies, but also coordinating the Federal agencies and the advocacy organizations, individuals, and others to really try to come up with really community viewpoints about what should the priorities be within research, what should the priorities be in terms of service delivery, invention, et cetera. So that I think that while there's always room for better coordination, I think the coordination among agencies is much better than it was a number of years ago. And in fact, across other areas of scientific research.
But you're also saying we can do better.
I think we can do better, but I think we are doing a lot better. And I would point to this as actually one of the areas in science where there is particularly good coordination at this point in time. Good enough, no, but particularly good, yes.
Let me ask this. Major Federal efforts to confront significant health crises have been mounted in the past. Breast cancer, Alzheimer's, and AIDS have all been the focus of major efforts. How do you think the Federal effort to confront autism spectrum disorders compares to those other Federal efforts?
Well, certainly, scientifically, they each present their own challenges and their own opportunities, but different kinds of challenges. One of the particular ones the Chairman already referred to in terms of the diversity of conditions are all lumping as one here. So I think that presents its own challenges. It also presents some particular coordination challenges as well. I think it's hard to compare, one sort of disease movement versus another. They need to all, I think, be crafted with acknowledgement of the particular qualities of the disease or diseases that you're trying to approach.
Let me ask you, yes, Dr. Boyle.
I was going to say that, I mean, autism, like breast cancer, is a very complex issue. And although it may not seem that, with Federal dollars, we've made considerable investment in research and programs and tracking. So, and we're just starting to see some of the benefit from that. We're starting to see some of the research come out. And I mean, there really is an explosion of information, a lot more to be done, particularly on the environmental perspective. A lot more focus has been on the genetics, and I think, and that's been a discussion at the IACC level. We need to be moving more into the non-genetic related aspects.
Let me ask you this. The Interagency Autism Coordinating Committee is the tip of the spear in the Federal efforts to strategically address autism. Is the committee's ability to accomplish its mission hampered by the absence of adequate representation from both private and nonprofit sector? And would the coordinating committee be better positioned outside of NIH, since treatment and services are important elements in the mission of the committee? And then you can answer that, and I'm finished.
The newly reauthorized committee is larger than its predecessor, and I think that has been an advantage to the committee. It has more membership. I think, like any committee, it struggles with, if you were to craft what's the perfect membership of the committee, you struggle with wanting clearly to be inclusive. and at the same time making the committee effective in terms of size, et cetera. I think that the committee tries to make sure about the inclusion by, in fact, inviting public comment at its meetings, having town halls, other kinds of things, so that even those not represented directly on the committee have a voice in the room.
I would agree with that, too.
I thank the gentleman. I now ask unanimous consent that the distinguished gentleman from Virginia, Mr. Moran, be allowed to sit in this hearing. Without objection, so ordered. I now would also ask unanimous consent that Mr. Burton has waived 2 minutes of his 5 minutes so that he can show a video before he begins. So if the video can be shown, and then the gentleman will have 3 minutes afterwards.
Thank you, Mr. Chairman. Let me preface my remarks by saying I know there's many causes of autism, but the one we're talking about today, as far as I'm concerned, is the mercury in vaccinations and in the environment. And the University of Calgary in Canada has done this research, and I want everybody in the room, and particularly my colleagues, to see what the research shows.
How mercury causes brain neuron degeneration. Mercury has long been known to be a potent neurotoxic substance, whether it is inhaled or consumed in the diet as a food contaminant. Over the past 15 years, medical research laboratories have established that dental amalgam tooth fillings are a major contributor to mercury body burden. In 1997, a team of research scientists demonstrated that mercury vapor inhalation by animals produced a molecular lesion in brain protein metabolism, which was similar to a lesion seen in 80% of Alzheimer's diseased brains. Recently completed experiments by scientists at the University of Calgary's Faculty of Medicine now reveal, with direct visual evidence from brain neuron tissue cultures, how mercury ions actually alter the cell membrane structure of developing neurons. To better understand mercury's effect on the brain, let us first illustrate what brain neurons look like and how they grow. In this animation, we see 3 brain neurons growing in a tissue culture, each with a central cell body and numerous neurite processes. At the end of each neurite is a growth cone where structural proteins are assembled to form the cell membrane. 2 principal proteins involved in growth cone function are actin, which is responsible for the pulsating motion seen here, and tubulin, a major structural component of the neurite membrane. During normal cell growth, tubulin molecules link together end-to-end to form microtubules, which surround neurofibrils, another structural protein component of the neuronal axon. Shown here is the neurite of a live neuron isolated from snail brain tissue, displaying linear growth due to growth cone activity. It is important to note that growth cones in all animal species, ranging from snails to humans, have identical structural and behavioral characteristics and use proteins of virtually identical composition. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here. In contrast, other heavy metals added at this same concentration, such as aluminum, lead, cadmium, and manganese, did not produce this effect. To understand how mercury causes this degeneration, let us return to our illustration. As mentioned before, tubulin proteins link together during normal cell growth to form the microtubules which support the neurite structure. When mercury ions are introduced into the culture medium, they infiltrate the cell and bind themselves to newly synthesized tubulin molecules. More specifically, the mercury ions attach themselves to the binding site reserved for guanosine triphosphate, or GTP, on the beta subunit of the affected tubulin molecules. Since bound GTP normally provides the energy which allows tubulin molecules to attach to one another, mercury ions bound to these sites prevent tubulin proteins from linking together. Consequently, the neurite's microtubules begin to disassemble into free tubulin molecules, leaving the neurite stripped of its supporting structure. Ultimately, both the developing neurite and its growth cone collapse, and some denuded neurofibrils form aggregates or tangles, as depicted here. Shown here is a neurite growth cone stained specifically for tubulin and actin, before and after mercury exposure. Note that the mercury has caused disintegration of tubulin microtubule structure. These new findings reveal important visual evidence as to how mercury causes neurodegeneration. More importantly, this study provides the first direct evidence that low-level mercury exposure is indeed a precipitating factor that can initiate this neurodegenerative process within the brain.
Thank you very much, Mr. Chairman. You know, there's an old saying, one picture's worth 1,000 words. I have read, I don't know how many studies on this whole issue. And I think I've had some of you doctors before. I think, Dr. Boyle, you've been before our committee before when I was chairman. And I have great respect for you and for the FDA and HHS. I think you do a great job. But sometimes I think maybe outside influences have too great an impact on the scientific research that's necessary to find cures for major problems. Now, we've gone from 1 in 10,000 children known to be autistic to 1 in 88. It is worse than an epidemic. It is an absolute disaster. And how anybody can look at that study and see the actual brain cells deteriorating when put next to a very small, minute amount of mercury, it mystifies me. How can anybody at the CDC and the FDA watch something like that and say that the mercury does not have an impact on neurological problems? Now, granted, it may be from other things besides vaccinations, but vaccinations that contain mercury should not, under any circumstances, be injected into any human being, especially children who have a very fragile immune system. And children get as many as 28 or 30 shots before they go to the first grade. My grandson got 9 shots in 1 day, and it turned him into a horrible situation that we banging his head against the wall, couldn't go to the bathroom, all kinds of things. And these people will tell you all about that. And so all I would pray to you, beg you to go back to FDA and HHS and say, come on, let's get with it. There may be other causes, but let's get mercury out of all vaccinations, which is a contributing factor. If you do that, and you can go to single-shot vials that cost, what, a penny, 2 cents a piece, it won't hurt anything. And I don't mind if the pharmaceutical companies get legislation passed here that protects them from class action lawsuits, as long as they help the Vaccine Injury Compensation Fund and get mercury out of these vaccinations. Please, I'm leaving. I'm not going to be here anymore. You won't have to watch me up here anymore. But please go back and work on it, will you? Thank you.
I thank the gentleman. We now recognize the gentlelady from the District of Columbia, Ms. Norton.
Thank you, Mr. Chairman. Actually, I would have liked to have heard the response given how, but I don't want to take it from my time.
No, it's, I apologize. The gentlelady is right. Did either of you had a response? I realize there was not an embedded question necessarily there, but if either of you want to make a comment on the video, if you're familiar with it, it will be in part of the record. You can do it afterwards, but if you had a comment now, we'd certainly welcome it.
Well, I'd be happy to make a comment about the vaccines themselves. So since 2001, thimerosal has been removed from all vaccines given to children, with the exception of the multiple.
Please, you know, we said that the record will remain open for all comments, including ones you may want to make as a result of this. So you will have an opportunity to voice yourself completely. Please, Dr. Boyle.
I'm going to say with the exception of the multi-vial flu vaccine.
Thank you. The gentlelady may begin.
Thank you, Mr. Chairman. I have a couple of questions. It really has to do with just who we're talking about. It would probably be the case that many of these children who may have some features of autism were not recognized early, and you indicated how difficult it is to backtrack and do something about it. So I assume that there are millions of people walking around, or not. Now, where we do recognize what is seen as a disability, the IDEA says there must be services provided in school and the rest now. So a child might be able to get, I don't know, all manner of services, services relating to speech and to movement, very primary services. Then this person graduates out of school where there is no IDEA. What does, so I have to assume that there must be parents and relatives with such children who were not recognized, for whom nothing was done. What are we doing about these young people or older who have not had any services? Do they have anything like IDEA available to them? Any services that they automatically qualify for? If not, what do we do with them?
Well, I mean, I think that's a real challenge. This topic about understanding transition from childhood to adult and sort of the services associated, the benefits, the impact of autism across the lifespan is a really important.
No, but my question goes to what do we do to the child who is no longer a child, 18 or 19? The mother and father have done all they could. This is an adult child. These may be aging parents. What does that young person do? Dr. Guttmacher?
Well, I think, Congresswoman, it's clearly a real challenge for our society. And as you well know, your historic interest and support for the Down Syndrome Caucus, many of the issues you're bringing up here as applied to autism are extremely similar, if not identical, to those for children who become adults with any kind of disability or
except that we could recognize Down syndrome.
Exactly. So there is clearly an advantage of having been diagnosed earlier in life and getting services.
What are we doing with these young people, Doctor?
Well, we're doing, I think the first thing we're trying to do is to diagnose more effectively early.
No, I want to know today, you have such a person, they weren't diagnosed effectively, is 21 years old. What do I as a parent do with this young person?
Well, the first question is, even if it's recognized at the age of 21, often individuals who we would now describe as being on the ASD spectrum are simply seen in their families having particular character traits or whatever and are never, quote unquote, diagnosed. I think the question for any of these, for parents of young adults and for the young adults themselves, is trying to find the best fit in society in terms of employment, et cetera.
Thank you, Doctor. I have one more question, and my time is running out. In other words, there's nothing that we're doing to them. It looks like we don't have any mandated services for them, and that it falls back. The Affordable Health Care Act may help to provide some medical services, but this is tragic if we have not found, not a bridge, but a way to accommodate an adult who may still become a functioning member in some way in society. But this is the question before my time runs out. I've often noticed that parents of highly educated people come forward and speak up for Down syndrome, so middle-class parents. Why is that? Is there a difference in who recognizes? Is there a difference in who gets it, an ethnic difference, a class difference in who gets or recognizes this disease or this condition? Or is it an across-the-board condition?
It's an across-the-board condition. There clearly are issues, again, because it's not always diagnosed. Those who have greater access to higher quality medical care, since it's usually a medical diagnosis that's made, tend to have the diagnosis made more frequently. So those who, for various reasons of barriers to access, are less likely to have the diagnosis.
What is the minimum age that we should be looking to if we have a child to see whether autism is perhaps there?
As I mentioned in my testimony, there is now a checklist and approach that's being used right around 1 year of age in the hope to make the diagnosis at that point, and we hope eventually even younger. The younger we can make it, the better.
Thank you, Mr. Chairman.
Thank you. Dr. Boyle, I think you had an additional statement.
Well, a couple points on that last one. So we do have tools to help parents identify children as early as possible. Those are free. They're on our website. And the most important thing that parents
They know it. The mother knows it. The father knows it. It's what is available.
We have information about what to do with it, how to have a conversation with your physician. So really guiding parents with that.
Thank you, Mr. Chairman. In other words, it's up to the family to try to figure it out.
I thank the gentlelady, and Thank God that there are families who care so much, and that is always a big part of it. With that, we go to our first doctor on the panel, Dr. Gosar, for 5 minutes.
Thank you, Mr. Chairman. First of all, I'd like to acknowledge my colleague, Mr. Burton, for making this, instrumental in representing so many people out there. One of the things I wanted to ask Dr. Boyle in your testimony is I didn't hear a prevalence about diet.
Excuse me, could you
I didn't hear a pertinent aspect of focusing on diet.
Diet. So we do, within the context of our epidemiologic study, we do ask about information about diet.
It seems to me in the coordination, and I see the frustration. I was a practicing dentist for 25 years. I'm also celiac free, by the way. So I can understand their frustration. It's mortifying. When you try to go for studies, I mean, the coordination of studies is inherently poor. Absolutely horrible. I mean, even to recently as last year. But we have people that are so motivated in these families. When I would give post-ops to families, you get about twice the support. With autistic families, they're begging for more support. I mean, you're getting tenfold heroistic type of aptitude and findings. And I'm finding more from them than I am from the medical research. And it seems to me we're focusing something wrong here. We should be focusing on the family. They're telling you what's going on, and they're frustrated is because the research is cylindrical. They're not sharing. They're not coordinating at all. And they're telling you what's going on and what's wrong. And we should be focusing on the family and utilizing that as a coordinating factor. Now, I want to get back to diets. I mean, I've got family history with this and the genetic factoring. We got to spend more time looking at the genetics because there is a trigger mechanism. And celiac brew is one of those. Looking at casein as well. There's so many things. And you cannot point to me to a disease factor. Point to one of them. I dare you. And we'll find a dietary problem with it. I mean, diabetes, heart disease, thyroid conditions. You name them, MS, you're going to find a dietary aspect. So part of the problem we ought to be focusing on is the dietary aspects. In the aspects to my colleague from D.C., is we ought to be looking at how do we help parents in a dietary format. This is what my experience was. I spent every night after my practice closed going through aisles in a grocery store, looking at everything on the aisle to make sure it didn't have a gluten or wheat. Do you know how long that took? It is unbelievable what these people have to do. Absolutely unbelievable. And we got researchers who don't listen to them. To me, this is just absolutely incredible. And I think it's a slap in the face for these people to be looking at those aspects. And here's how affluent it was. One of my siblings has a son that they said was autistic. Thank God one of my sisters is a physician. In going through this tirade, we found out that she had celiac brew. And she wondered, I wonder if this is the problem for her son. Isn't it interesting? We had a kid who was diagnosed or labeled as autistic, that as soon as we took him off of wheat, gluten, and milk products, this kid sits, reads, does everything appropriately. And I think we can manage this practice a little differently. Sometimes we're in the forest and we don't even understand what we're looking in the trees. Is manage these disease processes is by family, by looking at that as our core group, and then start listening to people, asking a question. That's what we as physicians were taught to do, is ask questions and listen. And I think that's part of the biggest problem that we see in this research aspect, is we're not listening. And I think I see that frustration all over your face. I mean, holy cow, the genetics aspects. Just to give you an example, we were scheduled to be a part of a genetic study for celiac brew, which is inherently a big process to autism. There are 10 kids in my family. Out of all the grandkids, out of the 17 grandkids, 13 have celiac sprue. You think you'd use our family. You think. Boy, sad excuse, we didn't. So we're missing the boat here, and we need to have better coordination, much better than what I'm seeing here currently. So thank you.
The gentleman yields back. Now, I appreciate that this is a hearing that many have waited a long time for and that it's popular, but I would ask, please, that we neither have the positive nor the negative from here forward if possible. And with that, we go to the gentleman from Ohio, Mr. Kucinich, for 5 minutes.